Right, there we go. All right, guys, thank you for being here. This is our Moving Forward webinar series, and we've got Dr. Tim Romanowski, actually who I went to high school with, fun fact. So he is going to talk about revolutionizing healthcare and has a direct primary care office here in Annapolis. So I'm sure he's going to tell you a little bit about himself and his story and how he transitioned into direct primary care. So with that, I will turn to you, Dr. Tim.
Thank you, Amy. So, good morning, Dr. Tim Romanowski. I'm co-owner of Warrior Medical Group here in Annapolis. First of all, I want to thank the Chamber for allowing me to talk to everybody today, and my friends and colleagues in the direct primary care community who loaned me some of their slides for this presentation. So today we're going to be talking about ways we can revolutionize the healthcare system with the power of direct primary care. So direct primary care is an alternative way to think about the healthcare system and how to interact with it. We're going to explore the benefits of direct primary care that it offers to both patients and businesses, including cost savings, enhanced access to care, and increased health outcomes. So a little bit about me. Like you said, I'm from Annapolis originally. We went to high school together. Live here in town with my wife, two kids, and my two doodles. So the one doodle is a Bernan doodle, the other one's a golden doodle. And about 2.5 years ago, I started Warrior Medical with my business partner, Valerie Wallace. We were both part of the same healthcare system, just practicing at sister offices. Our practices were owned by a local system, and we became very disillusioned by the way we were treated, by the way patients were being treated, and realizing we just weren't offering quality care. We got locked into this model of, we're being asked to see 20, 30 plus patients a day for 10, 15 minutes at a time, rushing through appointments, chasing those insurance dollars. And, someone comes in with 10, 20 complaints. I can only handle one. Please schedule another appointment. Next appointment's not until 6 months away. So really not fixing things, just putting pretty much band-aids on everything. So we ventured out on our own, created Warrior Medical as a direct primary care office so that we could serve our patients more effectively and efficiently than what the current system allowed. It also allowed us to practice medicine without the mandates from administrators or health insurance companies on how to care for patients. So today we're going to understand the current state of the healthcare system in the US, what direct primary care is, also referred to as DPC, and how it differs from traditional healthcare models. We'll also explore the benefits of the DPC provides for patients, followed by the advantages it offers to businesses. And we're going to also discuss some cost savings, healthcare cost savings. So the current state of the US health system is very complicated, and I'm going to do my best to try to, get this down to more understandable bites. So this currently is what our healthcare system looks like from the patient level all the way up to the Secretary of Health and Human Services. Very, very complicated, very, very messy, lots of bureaucracy, lots of administration. The two big things in here are in the bottom left-hand corner, where it says physicians, and the bottom right-hand corner, where it says patients. And really, there's no direct link between them. You come and see your provider, but really, it's this whole network we're working through. So let's look at a typical flow sheet on what happens. A patient has a fever and a cough, and they want to schedule an appointment. So this represents what happens when a patient is sick and needs to be seen. So the blue boxes are the providers, the physicians. The yellow boxes are patient contact points, and the red are insurance and administrative points. So, excuse me. So the patient has a fever and cough, and they try to schedule an appointment. Now they have two options. One, the patient can go to the ER, or they can wait 2 to 5 days to try to get in with their provider. If they go to the physician's office, there's a copay that's collected, and eventually you're seen, a diagnosis is made, and the patient receives treatment. Meanwhile, in order for the diagnosis to happen, there could be blood work, radiology, and of course medications. Blood work, radiology can always be denied. and then we're back to square one, coming up with alternatives. The medications can be denied. Go back, come up with alternatives. So out of all these touch points, only three really involve patient and physician. So very, very ineffective, still very complicated. But let's look at this a little bit closer. What it looks like the day of when you walk in. So, you wait those 2 to 5 days, if you're lucky, sometimes 3 weeks for your acute visit. So you finally get your appointment. You're asked to arrive about 15 minutes early to complete paperwork. You go to the front desk and you check in, and they act like they have no idea who you are, why you're there, and they've never seen you before. And they inform you that the doctor is at least 30 minutes behind schedule. So you're waiting in the waiting room for about 45 minutes, and you're finally brought back to the exam room. At that point, the medical assistant starts checking your vitals, asking you why you're there, and then a whole slew of questions that really don't relate to why you're being there. And really, these are helping us to fulfill metrics and mandates from the insurance companies, from the hospitals, so that we can boost reimbursement rates so we're not losing money. So your 20-minute appointment is now down to 5 to 10 minutes with your actual doc because of everything that just happened. The doc's running late. And he's barely any time to listen to you, let alone look at you before handing you a script and rushing out the door to the next appointment. Very unfulfilling for the patient. It was not a good experience. Very dissatisfying for the doctor because I didn't actually do anything. So this shows us the inefficiency of the medical system. So the patient waits months to book an appointment, waits hours at the doctor's office for the appointment, is rushed in and out of the room, and you have to repeat the story so many times to every person who walks into the room that you come in contact with. Then you have to wait at the pharmacy or the lab, and then our final diagnosis every time is very time consuming. It's nerve-wracking while you're waiting for all that to come back. And it's just very inefficient. While on the doctor's side, we even see more inefficiency. A family medicine physician, such as myself, needs about 26.7 hours per day to complete all required tasks and provide all our recommended care that is based on national standards. On average, about 2/5 of an 8-hour working day is now then spent on insurance paperwork after seeing the patients, 2 hours of paperwork per 1 hour patient care, and then each doctor or provider needs around 2 full-time staff devoted just for billing insurances alone, and this leads to a lot of problems for the physicians themselves because this leads into physician burnout. A recent study conducted in 2022 found that physicians are burnt out at about a rate of 60%. So 60% of physicians have felt inappropriate feelings of anger, cheerfulness, or anxiety over their job. 30% have felt hopeless or they have no purpose or impact. 50% have reported withdrawing from friends, family, and coworkers. 62% have feelings of burnout compared to about 40% pre-pandemic. And 64% of all employed physicians have feelings of burnout. When physicians feel burnout, their quality of life goes down, quality of care goes down. And speaking from personal experience, this is exactly where I was, and that's why I left the system and started my own practice. And I came to the realization that if I can't care for myself appropriately because of the pressures of the system affecting my health, how can I effectively care for my patients and care for my family in any sort of meaningful way? So physician burnout is a big driving factor why we start starting to see a physician shortage as well. Everyone's leaving because we just can't take the pressure. This is not what we were trained to do. And healthcare tends to be expensive too. Uh, the US spends about 16.9% more of its GDP than any other country on healthcare alone. but yet we still have one of the highest infant mortality rates and overall mortality rates in the world. Per capita, the US spends almost twice the average over wealthy developed countries. So on average, $5,000 is being spent by other countries. The US spends over $10,000 on healthcare compared to those other countries. So what is the problem? What can be done about that? So, yep, insurance, it's very multifactorial. One of the issues is insurance companies. So the top five US health insurers, annual profits jumped 230% since the Affordable Care Act passage. The lion's share goes to United Healthcare, which reportedly denies 1 in 3 medical claims from policyholders. So yes, their profits are going up due to, quote, healthcare savings. The CEO of United Healthcare was able to bonus himself $23 million due to healthcare savings alone. But that is not passed on to the patients. Patients see increase in premiums and increase in deductibles constantly. This graph, we can see the average annual expenditures for healthcare since the Affordable Care Act went into play. If we follow that dotted line, that's what was predicted to be the healthcare cost if there is no Affordable Care Act. Since the Affordable Care Act, that has jumped over 38%. So yes, we are spending more on healthcare now. On average, the Affordable Care Act marketplace insurers are raising premiums by about 7% this year alone. So let's look at the numbers for Maryland. Care First is raising rates by about 14.2%, Aetna at 10%, and Kaiser is about 8.5%. And these increases are in premiums that are being passed along to the subscribers, so subscribers being patients. So 2022, this is a typical plan someone has. Individual healthy 40-year-old average premium is about $5,700 per year. Average deductible, $4,400. Deductible and premium, we're looking at spending about $10,000 per year with a total max out of pocket of about $6,000. So if you're average in the best year, you're spending about $5,700. Worst, you're spending about $12,000. And then if you're a family, a couple with 2 kids, same thing. The premium is about $1,500 and the deductible $1,800 combined with the premium. So we are spending a lot of money. And there's we know there's also a lot of waste in healthcare. This article is from the Wall Street Journal back in September of 24. Insurers pocketed about $50 billion from Medicare for diseases that no doctor ever treated, and they were actually diagnoses created by the healthcare companies. So this graph breaks down how much each of those healthcare companies took in, and these numbers are in the millions. So United Healthcare added diagnoses at a far higher rate than other major insurers. So yes, all these healthcare companies stole about $50 billion from the Medicare system alone. And if we look at this graph, the gray striped area of those charts where diagnoses were made by the insurer. So we can see they're diagnosing about United morbid obesity did about 1,100 people, heart failure 925. But but these aren't even being treated. If a physician diagnosed, let's talk about HIV, there's a 92% chance that that patient was being treated appropriately with the correct medications, compared to the diagnosis made by a health insurance. 17% of those were actually being treated. So United Healthcare diagnosed over 1,200 people, almost 1,300 people with HIV, but only 168 of those were actually receiving treatment. It's almost as if these people didn't even have HIV. So less than 17% of patients with insurer-driven HIV diagnosis were on any sort of retroviral medication, which is the treatment for HIV. it seems like almost all these people don't have HIV. If they did, this would be substandard of care at a pretty severe level. And honestly, this is malpractice. You make the diagnosis, you're not treating. But our insurance companies aren't fully to blame for the current state of our healthcare system. And expenditures, the majority of our expenditures actually go to administrative costs. So the US spends significantly more on administrative costs, but less on long-term healthcare than any other wealthy country. So the United States is spending about $843 per capita on administrative costs compared to $511 on long-term care. Administrative costs are what is killing the US health system. So if we look at this graph, this comes from all the way from 1970 all the way up to 2009. The yellow area is the growth of administrators within the healthcare system. And the reddish area, that is the growth of physicians in the healthcare system. The healthcare dollars that we see for these administrators' costs are all going to administrators. We can see the U.S. healthcare spending per capita, the yellow area represents the number of administrators hired or to the system. And like I said, the red is for the physicians. So let's break this down in some understandable numbers. For every physician, there's roughly 10 administrators. So when people say that, no, the problem with healthcare is it's physician salary driving up the cost. Well, no. In general, hospital administrators and CEOs often earn significantly more than physicians and providers, with hospital CEOs potentially earning in the range of $330,000 to $1.7 million, with some CEOs significantly making more. And physicians' salaries are typically in the mid to lower six figures. So by saying the physicians are to blame because of our salaries, this is all administrative costs that we're seeing. So what is the answer? Direct primary care is an innovative healthcare model that emphasizes a direct relationship between patients and their healthcare providers, often through a subscription or membership fee. And this model prioritizes patient-centered care and accessibility. So, direct primary care is defined as a model where patients pay a monthly fee directly to their health provider for a range of services. This model eliminates insurance companies from the equation, allowing for more personalized, accessible care, cuts down on the administrative overhead, and it also allows physicians and providers to actually practice medicine in a meaningful way. Unlike traditional insurance-based care, which often involves high premiums and deductibles, DPC allows patients to access care directly. This model reduces administrative burdens and focuses on the patient-provider relationship. And this is what we all are lacking. I mean, I don't know, like I said, we go on to see our provider. We just feel like they didn't listen. And that's what I hear every single day is, I now feel like I am being heard and we're actually making progress. I want to be a part of my healthcare now. The DPC model typically includes unprecedented access to your provider through emails, telephone calls, virtual appointments, in-office appointments, and most of my patients will actually text message me. Longer appointment times and a wide range of services without the interference of health insurances. This creates a more significantly satisfying experience for patients and fosters a stronger connection with providers. So yes, it really can be this system, this simple, to help revolutionize healthcare and get us back to a healthy country. So we're often asked, what is the difference between us and a concierge model? So we do share a lot of similarities with concierge medicine. We have smaller patient size, we're high quality care, and we're accessible. And it becomes very personalized service. Unlike the concierge model, which still accepts insurance, so they're chasing insurance dollars, they charge co-pays at each visit. We don't. It's a flat fee. You know what you're getting. we care for all incomes, we can reduce healthcare costs, and we're good for small businesses as well. For us, one way we can cut costs is we've actually arranged for cash rates with local imaging center and local laboratory, and these tend to be actually cheaper than what the health insurances will pay. So patients benefit significantly from the direct care model with enhanced access to providers and a focus on a preventive care. Patients can better manage their health and avoid costly interventions down the line. DPC provides patients with easier and more direct access to their providers, often through same day or next day appointments, telemedicine options, and flexible office hours. Of note, as of the first of this month, Medicare was going to suspend paying for televisits, and typically what Medicare does, the commercial insurances will also follow. So I can see that televisits will probably become a thing of the past, or at least for being paid for. Uh, the direct care movement Through the direct care movement, we can still offer televisits as a convenient way for patients to see their physician or provider without having to take time off of work or interrupt their day. And we emphasize personalized care. Medicine's not always cookie cutter. There's no simple cookbook recipe. Yes, some things are very similar, but we take the whole person into consideration. So this allows providers to spend more time with each patient and focus on preventive care, and that identifies and address health issues early, leading to better outcomes. I've had a couple patients who'd followed me from my old practice, working them up for a long time for various things. And then just by sitting down, having a conversation, I was able to diagnose better than just by running tests, pushing them in and out of the office as I'm trying to make my next appointment. You develop the relationship, you develop trust, you develop better care. One of the key benefits of DPC is cost transparency. Patients know exactly what they're paying for and can budget accordingly, resulting in more affordable healthcare options without unexpected bills. So for us, we have a monthly membership fee, so they know that's going to be paid every single month. There's no other hidden charges. We do charge small nominal fees for office procedures like joint injections, those types of things. But that's very upfront, and we let the patients know before we proceed with anything. Businesses can also reap significant advantages from implementing a DPC for the employees. From reduced healthcare costs to improve employee health, DPC can enhance overall workplace productivity. By adopting DPC, businesses can lower their overall healthcare expenditures. This model reduces the need for expensive insurance plans and helps manages costs more effectively. Direct care allows access to healthcare, and this leads to better employee health outcomes. Healthier employees are more productive, and businesses benefit from a reduction in 6 days and can have an increase in morale. DPC simplifies the administrative burden associated with traditional insurance. With fewer claims to process and less paperwork, businesses can operate more efficiently and focuses on their core activities. So what are the cost savings for patients? Patients can experience substantial cost savings with DPC as they can avoid the high premiums and out-of-pocket costs associated with traditional insurance models. And this makes healthcare more accessible to everyone. DPC patients pay a straightforward monthly fee, eliminating the need for complex insurance premiums and deductibles, resulting in predictable healthcare costs and improved financial planning. Subscription-based models, subscription-based pricing model of DPC allows patients to budget for their healthcare, and this affordability helps improve barriers to accessing necessary medical services because you know your doctor's there, you can get in, you can contact them. So yes, we can prevent ER visits, urgent care visits, which just add to that administrative healthcare burden. Patients experience fewer out-of-pocket expenses when using DPC, as many services are included in the monthly fee. This leads to better financial costs and reduction and reduce stress regarding healthcare costs. Some DPCs even have small pharmacies in their offices, which provide a lot of generic medications. We're not at Our office is not at that stage yet, but we're looking into it in the future. And these tend to be pennies on the dollar for generic medications as well. We do use some alternative pharmacies, such as Cost Plus Pharmacy, which is a mail-in pharmacy that does have very cheap generic drugs. And we do offer this for patients who we know who are struggling financially. So cost savings for businesses. Businesses can achieve significant cost savings by incorporating DPC into the employee health benefits. This model not only reduces direct costs, but also enhances employee satisfaction. Adopting DPC can result in lower overall healthcare expenditures for businesses. By streamlining healthcare delivery and focusing on wellness, companies can save money in the long run. So if we announce prevention is worth a pound of cure. The DPC model lets small business slash healthcare costs by about 40%. So enjoying predictable expenditures and foster better healthcare outcomes as well. With improved access to care, employees are less likely to miss work due to health issues. This decrease in absenteeism translates into a greater productivity for businesses. Like I said, most of my patients, hey, doc, I don't know what's going on. I just get a quick text message. Okay, don't need to bring you in. Don't need you to take time off of work because we know that's important. We're conscious of our time and our money. We want to be conscious of yours. So that's one reason why we allow for text visits. So employee savings with direct care model, 54% reduction in emergency room claims, 25% fewer hospital admissions, and 13% reduction in total cost of claims. Employees who have access to affordable and effective healthcare are more satisfied and less likely to seek employment elsewhere. This leads to enhanced retention rates for businesses, which means that institutional knowledge remains with your business. So you're not always training new staff. That you have that older person who's been working there forever. They know how the system runs, how to be efficient at it. They can now pass that knowledge down and create that atmosphere that we're all looking for as business owners. So, in conclusion, direct care presents numerous benefits and cost savings for both patients and businesses by focusing on accessibility, transparency, and personalized care. DPC has the potential to transform the healthcare landscape. So let's just summarize real fast here. So what is it? It's a contract between a provider and a patient, a low monthly fee for medical services. We do not bill third parties for our services. We provide care to uninsured, underinsured, or fully insured. Insurances can still be used for medication, labs, and imaging when advantageous. Again, you have it, we're going to use it. DPC docs have smaller patient panels of around 400 to 700 compared to the typical system, which was about 3,000 patients attributed per provider, up to 5,000. And overall, it's better access, better care, better outcomes. The benefits, it's direct access to your doc in person or by phone, text, emails, or video with no copays or visit fees. You see the same doc every visit and have a relationship with them. We know you more than just a patient. Let's relax, extended visits, minimal to no wait time, same or next day availability. We can do several in-office tests and procedures that are included in the membership, save money on labs and imaging by eliminating urgent care visits and preventing ED visits, save time with convenient virtual care and spend more time with your doc than out in the waiting room. It's transparent, it's predictable, simple billing, and this is family medicine the way it should be. Doctor, patient, relation. So before we wrap up here, I want to give two testimonials. These are actually two of my patients, so I'll let them speak for themselves here.
Let's talk about the excuse that you made this week. Not calling your doctor. It's probably why you're seeing this video review. Something's telling you that you should call your doctor, and you aren't doing it because you're making an excuse. That was me. I did not want to call. It was a hassle. Get on their books, get on their schedule, take off work, do all this stuff. Granted, you have to do that everywhere you go for anything, but we're your medical group. makes it that much easier, right? You just pick up the phone, text, ask a question. Dr. Tim, at least, is extremely involved in the community. I get to see him out around Annapolis, and his office is extremely close. There is no reason for me not to prioritize myself. That's why this medical practice is where I continue to go.
I love to ask people what's the best thing they bought this year. And for me, the best thing that I've purchased in the last 10 years is Dr. Tim and his services. Because time is the most valuable thing. And as a business owner, I don't want to take the time to go to urgent care, to go to my doctor, just to deal with that whole process. And so I end up not taking as good care of myself as I could. But since being able to have the concierge service, being able to have Dr. Tim in my corner, I've saved so much time and I'm taking such better care of myself. And it's by far, it's the best purchase I've made in the last 10 years.
So I picked these two guys to do testimonials because this is actually an unreached group. The young male who really hasn't thought about his health. And this is who we're now reaching, who we're now taking care of, who now we can get preventative care so they can stay healthy, act young as they age. So I want to thank everyone for listening, and I'll take any questions.
I have some questions.
Okay.
I have questions too. Everyone has questions.
Sure.
Who's up first? Is that Gabby? Who went?
Gabrielle, yeah.
You're up.
I can jump in. So my question was on the monthly fee. Is there a scale for that, or how is that determined?
Yep. So there is a scale for that. Our monthly fee is 26. If you're 26 and above, we charge $150 a month. From the age of 18 to 25, it's $75. And then we see down to the age of 12, so 12 to 17, it's $50 a month with a paying adult.
And does that include your appointment
That
to go
includes your
see
appointment.
someone? Wow.
Yep.
So if I just want a wellness check, that would include my wellness check.
Includes your wellness check.
Wow. Is there a, are you locked in?
So we ask for a year commitment, and
Okay.
most people do see the benefit of it. You know, some people do kind of treat it as that gym membership. You know, most people pay for a gym membership and never go, which that's okay. It's probably not the best way to do it. We do have people on the other extreme who are always contacting us, but most people are right there in the middle. Hey, I got something. Can we just have a quick phone call, quick chat about it? Do I need to come in? So yeah, we see the whole gamut, and it's helps everyone. The people who treat it as a gym membership like the convenience of knowing, or the certainty of knowing someone is there for me, no matter what.
And this should be treated as a supplement to your insurance. Like you have the insurance for emergencies or
Correct. Yep.
those prescriptions and things like that.
Yep. So there are like some prescription only insurances, some of the catastrophic insurances, or even if you're familiar with what a health share is, a lot of people will use that as well.
Because I was wondering if people typically restructure their insurance when they go with this model because they're not going to need, to see a doctor through their regular insurance.
Yep. Some of them will. We do encourage people to try to submit to their insurance because sometimes they will get reimbursed. Sometimes it's at an out of network rate. I can't guarantee that, but I know some of our patients have had success with it.
Thank you.
I have many questions, but one from the business side, some from the medical side, some from the economy side. Medical records. How do you have access to the patient's medical records? Can you get them pretty easily?
Yep. So what we do is if you come to us as a new patient, we have a medical record release form. We'll send back to your old provider and we'll get the records. They get scanned right into our EMR. We have a web-based EMR, so nothing's stored on site. We also have access to the Epic portal of Anne Arundel and University of Maryland, so we can see a lot of that. Especially if someone goes to the hospital, we can follow along that way as well.
To jump up to the economy kind of a question, hit me again with the numbers on not the numbers, but why did the healthcare costs explode after the ACA?
So they exploded because that was you've now flooded the market with people who are now insured.
Right.
So when we talk about healthcare in the US, we get kind of confused. What I do, what Valerie does, my partner, what your doctor does, that is healthcare. Now, the Affordable Care Act, that gives you access to insurance. So now you have all these costs coming in from insurances, and people are just trying to find docs. So yes, you created more of a shortage. So that's why we saw those explosion in costs, because now people are utilizing more emergency rooms, urgent care as their quote primary care, and that costs a lot more than actually seeing a family doctor internist in an ambulatory office.
So, in staying in that regard a little bit, what is the pushback on telemedicine for, visits to a doc?
The pushback, this is driven by Medicare. It was done originally as an emergency thing due to the pandemic. If you look at the original language in how Medicare was supposed to pay for televisits, the patient has to be in a what they call a site of origination, which is a secure site. Um, a library, a bank, patient could not be at home, could be in another doctor's office. That's considered a site of origination. The doc could be anywhere as long as they're in the same state. So when the pandemic hit, all these rules went out, and now they're just seeing that a burden trying to follow these rules. So that's why Medicare doesn't want to pay for them anymore.
So if they went back to them, if I wanted to have a televisit with my doctor, I'd go to the library.
Yep.
Okay, well, I'm glad that makes sense.
The bank.
The bank, yeah.
The bank.
The people who benefited from the most, your elderly who are on Medicare, now just don't have good access because they can't follow the rules properly.
Yeah, the reason I'm doing the televisit is because I can't get out.
Mm-hmm.
Yeah.
But yeah. I have some other questions. Does anybody else have some questions? Jennifer, you have any questions for Tim or thoughts?
I don't have any questions, but just, Tim, so I'm part of SOFO, which is the Business Association for Forest Drive, and one of our members is Dr. Freeman with Evolve, and he's awesome. And so we're big fans of what you guys are doing and how you service our community. My mom uses direct primary care. She absolutely loves it. When it's done well, it's amazing. They're not all created equal.
They're
So
not.
just like anything else, she had a direct person in New Jersey that was terrible. Because he sold the practice, and whoever got it after it, wasn't the same. So it does matter who your doctor is. So,
there's a lot of practices out there that you can either take over, buy into. Big one is MDVIP, which is more the concierge model. But now you bought into another system, something that we're trying to break away from. So then, you still have more of that regulation headache.
Exactly. Yeah. But we're big fans. And obviously, just on a personal standpoint, I was in traditional healthcare for 20 years and we broke away 12 years ago. So ours is the same. It's direct access, physical therapy, pay as people go, and we keep costs way down. We can treat everybody. If people don't have money, we can meet them where they are. So it's the best of all worlds. So I would never go back.
I'm sorry, I thought of one more question.
Sure.
How does this model of healthcare, are you guys able to hire less administrators than the normal, since you're not working with third parties to fill out paperwork? So is it just less staff?
So currently my staff consists of myself, my partner, Valerie Wallace, she's a nurse practitioner. We have a part-time front desk staff who's kind of our office manager, jack of all trades. And we also have a podiatrist on staff. That's it.
Yeah.
And because we keep the patient panels a little bit on the lower side, I do have now time to do the prior auths, all those things that make the headache. I have time to sit on the phone and argue with an insurance company and still get denied, even though they agree that the patient should be treated. That's happened several times, but a lot of times on that end, those people we're doing what we call peer-to-peers with are incentivized to deny even more. So it's a racket. But yeah, no, it does cut down on administrative costs because my only overhead really is my rent.
You had a question about some of the stats that you shared. One of them, and I don't know if I understood it, that it seemed to, what I got out of what you were saying is the insurance companies were making diagnoses. Was that
Yep,
correct?
that's correct.
How is
So
that possible?
they will do quote chart reviews, and if certain words are seen or phrases, they can then go back in and say, hey, no, that was actually a diagnosis, and they can resubmit to Medicare for more reimbursement.
That's right. So, but what you had shared is that then they don't provide treatment for it, or
They do not provide
because,
treatment because they cannot practice medicine. And practice medicine is prescribing treatment.
so this is just use a technical term here, a money grab.
Mm-hmm.
Okay. So, two more questions on the business side of sorts. Do you have equipment costs, or do you have equipment in the office, or is that things that you refer out to, for X-rays and ultrasounds and all that good stuff?
So we have EKG machines here. So we have some aesthetic equipment, so I'm going to take that out of the picture. So basic medical equipment, we can do EKGs, urine tests. I have LabCorp right upstairs, so they do all of our blood work for us. Things like X-rays, ultrasound. We do have a portable ultrasound, especially with Dr. Patel, who's our podiatrist. We'll use that. X-rays, we send those out. I just don't have the space for that, and those are really expensive and beyond my scope of practice.
So, do you have any examples of businesses that have embraced this and offered it as an employee benefit?
Yep. Actually, Ernst & Young. We have several
Really?
people from Ernst & Young who, through their program, allows for direct primary care. So it's built in through their insurance. If you find a good healthcare broker, they can craft a program for you that includes direct primary care. They'll cover the costs. Yeah.
Is there, with this, it not being insurance, there's not a lot of regulations for an employer to do it. If they just wanted to do it, they would just do it. And it's something like a gym membership, as you referenced.
Yeah. A lot of people don't do it because they don't know about it, or because it's out of the box thinking and they just don't want to embrace it. It's not what we've always done.
Okay, so therefore we can't possibly do that.
Exactly.
Yeah. Yeah. So
I was talking to another local group who does insurance, and they're very interested in having someone for direct care to offer to their clients. So they're working on ways to integrate it into their benefits program.
have you thought about talking to Mark Cuban about pharmacy?
So I referenced earlier Cost Plus Pharmacy. That's owned by Mark Cuban.
Right.
So that's
Okay.
one we use, and it has actually saved a lot of our patients a lot of money on their medications.
Yeah, I think as a growth model for
Yep.
with direct primary care, that's a partnership. That's pretty cool. And there's a guy that's got a few bucks.
Yeah.
But so very, very interesting.
Yeah, like I said, we're exploring the option of having a small pharmacy in our office, but that's also then state regulations we have to follow, and it's actually Maryland makes it a little more difficult just because of expense wise.
Yeah. So
You mentioned your aesthetic service and you're doing an event in May. So is that totally separate from, so if you're a member and you have your monthly fee, that's all extra?
That's all a la carte stuff. Our members do get discounted prices on those services, but that's just something they started asking for it, so we brought it on board.
Yeah.
I mean, it's a one-stop shop, and it's fun for us. It does break up the day, and it's just something else to do.
but because you have time and you're not doing 26 hours of work.
Exactly.
So yeah.
Can insured people use their like flexible spending account money towards?
Yep. So we can
Yeah.
take FSA, HSA. We always recommend you to talk to your financial advisor about that too. There are some quirks in the system. when you can, when you can't use it. So just talk to them first, but we do accept it. The majority of our patients, I do believe, use it. It's actually about maybe 50-50 if you use a credit card or FSA, HSA, and we typically don't have a problem with things being clawed back.
Have you guys thought about getting somebody to do blood draws so that they don't have to go to lab 4 upstairs because they're terrible?
We have, unfortunately, where we are, there's an exclusive rights clause where we can't draw blood.
Right.
So we have to send them upstairs to LabCorp.
Gotcha.
We picked LabCorp. They were easy to work with. Like I said, they were convenient, but I do have patients who go to Quest, even the hospital. Yeah.
Are you considering any partnerships, perhaps with any local PT practices?
We've talked to several who are very interested in the model, and we do have some good referrals back and forth, but always happy to entertain more.
I don't know. Do you know anybody, Jennifer?
Yeah, I might know somebody.
All right, just the other thing I thought was very interesting is the your comment on the target market. You know, the young, what do they call that in the insurance world? The young invincibles, is that what they call them? Insurance, the younger guys, and I think that's the insurance term. They call them the young invincibles.
Yep.
I think that's the insurance term. What does that look like at this point? If you can share, you know, the breakdown of your patient in age cohort.
So we'll see from anywhere from age 12 all the way up. So I do have one patient who will be 100 in a couple months.
Yeah.
The majority of our patients, I say, would probably be around the 45 to 75 mark. We have some people who are older. A couple people now in that young invincible age. You know, around age 35, men tend to wake up and realize we're not invincible anymore, and we probably need to be taking care of ourselves. So we're starting to see that. The nice thing is, you know, we've captured a couple of these younger guys, and it's like, you know what, I need to do this for myself. I need to be there for my family. And what we're finding is most of the people who are coming to us are now very self-motivated to be an active part of their own health. And I think, you know, people have access to educational videos, YouTube, Instagram feeds, and all that, and it's waking people up, and they're seeking out better care apart from the current system. So I think that's why we're seeing more of an influx of the younger generation now.
Yeah, I mean, if they're instructed about, or they have communication,
you
know, with their doctor, and not the, you know, the 10-minute visit every year or 6 months or what have you. Those are things that you may well recommend, I guess. And then they're of that ilk and that know how to use the technology. They do it, and they become part of their own healthcare, their own system, really.
I mean, the one patient saying that he sees me out and about town. We go to the same gym a couple times. Like, hey, can I just talk to you? We'll go over to the corner of the gym, go to the locker room. We'll have a quick visit, find out what's going on. I can take care of him right there. I don't have to worry about those co-pays or collecting anything because I have a relationship with him, so I can treat him right then and there.
Yeah. Medicine as it should be.
Medicine as it should be.
Where did the name Warrior Medical come from?
No, we get that question a lot. So let me take a step back. So when we were part of the same healthcare system, my office got consolidated into Val's. She had a bigger footprint, and they hadn't opened up my office yet. My understanding is they didn't want to bring back all the staff quite yet. So we were sitting around kind of just complaining to each other, approached her with this idea of direct primary care. And at the time I was thinking also hormone replacement, which we do. And like, calling this Romanowski medicine does not sound right. Every combination, we didn't like putting our names in it. And we were kind of just sitting around like, okay, what is a good symbol of health, vitality, strength? And we came up with the idea of the warrior. And like that just kept popping up. So Val's late husband was military. He absolutely loved the idea. So we kind of ran with it. And then we realized, you know, just talking to our patients, everyone's like, caller. Was that? Oh. So everyone realized, you know, someone made the comment to Val, like, you know, the name really fits what I'm going through. I'm a warrior for my health, and you're helping me with this. you're helping me battle this cancer that I have that everyone wanted to ignore. So that's where it evolved into, we're warriors for our health, our longevity, our vitality.
Cool. Thank you so much, Tim. That was really awesome.
Well, thank you.
Yeah.
Pleasure doing it.
Yeah, no, thank you. This is, I think, so, for someone as an individual, if I heard the numbers, it's like $1,800 a year to be you consider them a patient or a member, or how do you categorize them?
Yes.
Okay.
We've gone back and forth on that term so many times. Like patient, we all familiar with that is. Also locks you into the old system. Member, yeah, you're a member with us, but also doesn't sound quite right. So
Client, we say clients.
we didn't like the word client.
We didn't like client either.
we just kind of stuck with patient or member. So,
Yeah.
because people understands what that means.
Yeah.
Cool. So,
Will you share those slides with us, Tim?
Sure. I'll email
now.
you as soon as we get off.
Yeah, that one slide was crazy. That first couple slides that you
Yeah.
showed of the map of the way that everything runs was.
Yeah.
I want to see that up close. That was insane.
Just as blurry as it looks to you, it looks even blurrier on my screen.
Yeah.
Because that's how crazy our system is.
Wow.
Yeah.
So since we have like 2 minutes and nobody else is asking, so your hormone replacement, are they bioidentical, or where are you sourcing?
Yeah. So we're doing bioidentical hormones. We do TRT and hormone replacement, men and women. We'll do creams, gels, injections, and pellet therapy.
Mm-hmm.
Most of our women tend to do more of the pellets and creams. Men are doing injections, and we're starting to convert more to the pellets.
Mm-hmm.
We use compounding pharmacies for those. One, if we do injections, they burn less when you inject because the oils they use. If for some reason you meet criteria for the insurance to pay for it, we try to get the insurance to pay for it.
Mm-hmm.
Yeah.
Thank you.
You're welcome.
all right. Well, I think that's a wrap. I think. Well, thank you, Tim. Very informative. I think you're, cutting edge, and you've got a lot.